Hey everyone, Darcy here from Darcy Proctor Wellness. For those of you who don't know me, I am a certified integrative health coach who guides and supports moms over 40 struggling with thyroid disorders to become vibrant, lean, and confident once again. So this month is Hashimoto's Awareness Month, and I wanted to make this quick video to highlight some vital information for those of you who have or think you might have a problem with your thyroid. I also wrote a much more detailed blog post about Hashimoto's that you can find on my website, darcyproctor.com/blog. So for those of you who are not familiar with Hashimoto's, it is an autoimmune disorder where the body begins to attack its own thyroid tissue, which eventually leads to hypothyroidism, which is when the thyroid gland does not produce enough thyroid hormone. So one thing that I don't think that many people realize is that it's rather rare for someone to have hypothyroidism without Hashimoto's. So is anyone out there only been diagnosed with hypothyroidism? So if so, you might want to go back to your doctor and see if they will test you for TPO, which is thyroid peroxidase antibodies, as well as TG, thyroglobulin antibodies. If these are present, then you definitely are experiencing an autoimmune attack. I want you to be aware, though, that a lot of labs that have a threshold, and so they'll only provide you a less than result. But in reality, even if you have only the slightest amount of antibodies that are detected, it indicates an autoimmune disorder. So please be aware of that. So it's important to know that if you indeed have Hashimoto's, because one, the treatment's going to be a little bit different, and two, you really want to be aware of this because unfortunately, if you have one autoimmune disorder, you're much more likely to have more autoimmune disorders in the future. So you really want to get a hold of this and take charge of it as soon as you can. So the signs and symptoms of Hashimoto's are really the same as hypothyroidism. Some of these include fatigue, weight gain, cold intolerance, impaired digestion, anxiety, depression, brain fog, muscle or joint pain and weakness, and hair loss, just to name a few. But you can check out again my blog post at darcyproctor.com, which goes over a lot more of these symptoms. And again, that's only just a small list, unfortunately. So now you know you're suffering from all of these hypothyroid symptoms, and you've gone to your doctor and gotten a complete thyroid blood panel, including the TPO and the TG antibodies. So now what can you do about it? So I first want to let you know that you absolutely can reduce your symptoms, if not put your Hashimoto's into remission, if you can make the appropriate lifestyle and diet changes. But you also need to address your root cause. We don't want to just slap a pill on a symptom. Unfortunately, this is the way things are done in conventional medicine. So you might have to do a lot of digging to really get down to your root cause. So it's going to vary it'll vary for everyone, but in general, the thing that you really need to address in an autoimmune disorder is removing your triggers and support the immune system. 80% of your immune system is located in your gut, so it's imperative to establish optimal gut flora and function. A large majority of autoimmune sufferers have what's called leaky gut, and this is where the intestinal lining becomes permeable, allowing toxins, antigens, and bacteria to leak out into the bloodstream. This in turn will cause inflammation and a possible autoimmune attack. Certain proteins like gluten and dairy are molecularly similar to the thyroid hormone, so just by cutting those two things out of your diet could reduce your symptoms dramatically. At the same time, you obviously also want to repair your gut lining. So eating lots of nutrient-dense greens and vegetables, as well as collagen from things like bone broth, can be really helpful. Try to avoid processed foods and focus on eating whole foods as much as possible. Another huge part of the healing process that I don't think gets as much attention as it should is reducing stress. Unfortunately, we live in a very fast-paced culture, and stress just seems like a way of life for us nowadays. But unfortunately, it's causing our body to be in chronic inflammation, and this just leads to a whole host of health problems. In addition to the diet and lifestyle changes that we just talked about, you might need to supplement with additional thyroid hormone medication. It's very standard for a patient nowadays to be diagnosed with Hashimoto's and prescribed Synthroid or its generic version, levothyroxine. In fact, Synthroid is the #1 medication prescribed in the US today. This helps increase the amount of T4 thyroid hormone in the system. But I want people to be aware that there are other options out there that may actually work better for you in your specific situation. So again, check out my blog at darcyproctor.com, where I've put in a chart of all of the common thyroid medications that are available currently. You'll see that there are T4 only medications like the Synthroid and levothyroxine that I mentioned. There's also just T3 only medications like Cytomel. And then there are combination medications like desiccated thyroid hormone. And this contains all of the different thyroid hormones that your thyroid gland naturally produces. There's actually T1, T2, T3, and T4. So this is where it's really important to get the assistance of a qualified functional medicine physician who can analyze all of your thyroid labs to make sure that you're on the proper medication at the proper dosage. So an example here, I personally was treated the typical way with levothyroxine for over 10 years, and not one single one of my symptoms changed. It was so frustrating, but I was just told you're supposed to just take this hormone for the rest of your life and you'll be fine. But nothing ever changed. And the reason that it changed was because I didn't have a T4 problem, but I had a conversion problem. So I was not taking the inactive form of the thyroid hormone, T4, and converting it into the active form, T3. And this is what really revs up your cells and your metabolic processes. So it really wasn't until I found a combination medication that I finally saw some relief from my symptoms, particularly my energy levels. It was like night and day. So I want you to really make sure that you're seeing a doctor that's going to look at a full thyroid panel, which includes free T3, as well as all those antibodies that I mentioned earlier, and also is willing to prescribe all these different forms of thyroid medication, because it's not a one-size-fits-all approach. We need different medications and different therapies for each one of us because we all have a different root cause. So I'm sorry I've thrown a whole bunch of information at you, but I hope this video has brought to light some really valuable insights regarding Hashimoto's. Again, please check out my blog post, darcyproctor.com/blog, for more detailed information about everything that I just talked about. And of course, if you have any questions regarding Hashimoto's or your own personal thyroid struggles, please feel free to reach out to me at any time. We can set up a free health consultation. I would love to chat with you. My email is darcy@darcyproctor.com. And if you're looking for some additional peer support with another a group of moms who are also going through what you're going through, I'd also encourage you to join my private Facebook support group, Healthy Thyroid Over 40. Don't worry, I'll put all the links for all of these sites down below in the comments below. But thanks for listening, and please pass on this information to any of your loved ones who may be struggling with Hashimoto's or suspect a thyroid disorder. The more we can spread the word, the more people we can help. I'll talk to you soon, and be well.